Hello Tasha, how are you?
Hi Diana, I'm very well, thank you. And yourself?
Yes, I'm all good. I have a few questions that I'd like to ask you. And the first question is, how are you looking after yourself and your teams in these challenging times?
It has been very challenging for all services within mental health and social care and the general healthcare. Us in Elft and certainly in Bedfordshire and Luton, we've done a number of things. When the pandemic hit and the country went into lockdown, staff were very good to embrace and put themselves forward to be working as and when needed. And it was very intense, and people weren't taking breaks, they weren't taking leave. And I think partly that was because they themselves were concerned about the staffing levels for the different services. So what we started to do was to really encourage people to make sure that they were starting to take breaks during the course of the day, to actually take some leave, even if it's not the longer periods of leave that they would normally take, shorter periods of leave, to ensure that they were looking after themselves so that they could continue to work and provide the services that we were providing. We've done a number of other things in relation to some of the services of established wellbeing rooms within the sites, particularly thinking of the crisis and the mental health hub care. What we had to do as part of the guidance, we had to minimise contact and reduce the amount of staffing within each site, and that meant us working on digital platforms. And so, for example, in the community in Central Bedfordshire, the staff were working 2 weeks within an office and then rotating with colleagues, 2 weeks working from home. It's quite easy to feel that disconnect, and when you're working from home, very easy for that 9 to 5 day to become a 6 till 10. So it was even more important than normal to encourage staff to have the breaks, to have that connection. And so that's just some of the examples. I mean, our OT colleagues have been very good in setting up mindfulness sessions, physical health activities, all on digital platforms, but staff then being able to access that to join in some of those activities. There's been a number of changes, and certainly we've had to embrace and make those changes very quickly, very quickly. A key one across all services is the use of digital technology and more telephone contact as well. So within all services other than inpatient, well, the inpatients are actually using it as well. Thinking of the crisis care pathway, the 111 option 2, which is mental health crisis line, has gone to 24 hours a day during the pandemic. Both in Bedford and Luton hospitals, the crisis services have developed mental health hubs. So that has meant that people in a mental health crisis haven't had to go to A&E, which obviously was a red zone, or continues to be a red zone during the pandemic. So it enabled people to access that mental health support separate to the general health A&E department. There's been really good building on relationships with some of our care home providers, and equally some strengthening of relationships between ourselves and different organisations. For example, the Wellbeing Service, Path to Recovery. In Central Bedfordshire in particular, we're now having meetings twice a week with primary care, wellbeing, P2R and the CMHTs to discuss people who have been referred to any of those services, and to very quickly have discussion and identify who is best met to provide the needs for that individual, so that there's no delay in people accessing the support that they may need. The Recovery College has been very much reliant on telephone contact and digital platforms. So they themselves are providing an increasing number of sessions through the digital platforms, and staff within the Recovery College will contact individuals and support them to be able to access a particular platform and then identify, how to log in and actually use that service, and so that they're not excluded. And where that's not possible, because there are some people that don't have that technology or access to that, then there's the telephone contact that they've been provided. Equal to that, we've had our people participation service that has identified a number of service users that have become befrienders, and they themselves are contacting service users that benefit from that additional contact and social connection with someone. All services have had to adapt to some degree or another. I mean, as said, with the crisis pathway, they've got increased telephone contact, they've got the mental health hubs, and they also do use digital technology where appropriate. Community mental health teams, telephone consultations, digital consultations. We use a range of different digital platforms, and that's all professional groups across, within a community mental health team. I mean, we're still doing face-to-face contact, but where it's appropriate, we're using digital platforms. Thinking of the mental health teams as well, we have depot clinics and benzodiazepine clinics. Now, they're clinics that are held on site, whereby people will come to receive a particular treatment. Now, there's been a range of responses by individuals around that, because some people, quite understandably, have been very concerned about going out of their home, going into a site where there are other people. Others have been very anxious about staff coming to their home. So we've adapted the services within the depot clinic and the benzodiazepine clinic to meet any one individual's requests, really. So, for example, the benzodiazepine clinic was predominantly a clinic that people come to site for. We invested a lot of time and staffing into ensuring that more visits could be done in the homes for those people that were requesting that. And it's the same with the depot clinics as well. During the pandemic, what we've actually done is we've moved that clinic to Carmel Court, which is at the hospital at the L&D, and that's meant that any individual going there can have and receive every part of that treatment and the medication all in one visit, in one go. So it's limiting the amount of times that people have to come out or attend a place to receive their treatment. It was particularly challenging thinking about inpatient services who were daily, working on the front line with people who may or did have coronavirus, and equally for our crisis care pathway, working with people, and also the challenges that brought about was for individual staff and their families and their colleagues. Within community services, what we did, we developed a tool to help guide staff to, when we were having any contact, any telephone, any digital, any face-to-face contact with people, we developed a tool which enabled that staff member to consider not only that individual's current mental health needs, but their physical health needs, taking into account the vulnerable groups and their needs in relation to lockdown and the pandemic. And when I say that, I'm thinking about that social disconnect, about people's ability to fund and go and get food. So to ensure that people's basic needs could be met. I think going forward, in particular thinking about Central Bedfordshire, one of the challenges is the sites, the space. We've put in very good infection control measures across all the sites, not just within the CMHTs, but all sites across Elft. And in Central Bedfordshire, two in particular of our sites are very small, very limited in space. So services will continue to work on a rotation basis. So we'll have some staff in the office at one time and rotate with a second group of staffing. So that will continue. But even taking that into account, the space is limited to be able to have that face-to-face contact. So we won't be able to see as many people on site. Now, obviously, we're community services. We go and visit people in their homes if people are comfortable with that. Just thinking firstly about the digital technology, that side of things. And as I've said, it's not necessarily for all, but we've had some really positive feedback from some service users about how it's enabled them to access services more easily. And when we think about Central Bedfordshire, the challenges of public transport, locations, the geographical area, sometimes it's quite difficult. I mean, thinking of the recovery college we talked about earlier, it's quite difficult for people to actually identify and access and get to a particular place to receive any treatment or access any service that they wish to. So the digital technologies really supported that, and as I said, the feedback that we've had has been very, very positive as well. The crisis line going to 24 hours, the mental health crisis line, being able to access that 24 hours a day is very positive. People will have a mental health crisis at any given time. It doesn't happen between certain hours. So in order to provide that now going forward, that's a real positive as well. Equally to that, the crisis team is able to support people of any age as well. And that's a change that's occurred during the pandemic. And again, a very positive change that we would want to continue going forward. Currently, the mental health hubs, the feedback we've had from that's been positive, because some of the feedback we've had in the past about having to go to A&E and sit in very busy departments whilst in a mental health crisis is very difficult for some people. So to be able to access that support separate to the general A&E departments has been really positive for some people as well. So again, that's something that we need to think about and take learning from and think about taking forward.
That's really good to hear. Thank you so much, Tasha, for talking to Healthwatch today. It's really interesting to hear of all the changes that you've made and the adaptations that you've had to make sure you can deliver mental health services and community services to people in Central Bedfordshire. So thank you very much.
Thank you.
Thanks, Tasha.